Welcome to Ampilatwatja. Ampilatwatja is situated 365 kilometres northeast of Alice Springs towards the Queensland border. The people of Ampilatwatja form part of the Yarawa Nation, with the local Aboriginal language being spoken by the majority of the community. Aboriginal culture, spirituality and society all depend on the relationship the people have with their land. This unique relationship entails knowledge and responsibilities to care for and to look after their land.
Could you reach somebody today? There's one more story to tell. Could you reach somebody today? There's one more story to tell.
Aboriginal people benefit from GPs who stay in their communities for long periods of time. This also provides the GP with real experiences of living and working within an ancient culture. It is an important investment for the community to have long-term GPs.
Designated the manager in October last year, and I have a vision to reduce morbidity and mortality rates in Indigenous people. We have been a little bit hamstrung in regards to having the services of a GP. You know, we enjoy having holistic care here that includes Aboriginal bush medicine, which is a big part of the Indigenous people here, as well as employing local Aboriginal people to help facilitate the needs of the people in the community.
My name is Divi Holmes. I work at the clinic as an Aboriginal health worker. Just helping out the people out here. Yeah, we support them doctors, like when the doctors are busy, we always get check up for him and put it on the paper so we can put it on the computer while he's busy with someone else. So we give him a hand as well.
Yeah, I work in Ampilatwatja. It's good for me, myself. It's a good job, and I always take people from Ampilatwatja, sick people, and I'm proud for that.
We live out here at Ampilatwatja because I'm working as a health worker here all the time, look after the community, go see all the patients and look around in the camp, do the diabetic blood sugar level.
We have diabetes, which is quite prevalent here in our community. Obviously, I think with the introduction of more Western style diet, but definitely from a cultural perspective, hunting and gathering, how family relationships would have been very important to them. And just overall, it's been a very big growth for me personally, and I've thoroughly enjoyed it. You know, I work quite closely with a lot of the men here in the clinic, and I've extended that out into the community and out when there's hunting, and you know, just to learn those things myself has been I class it as a blessing. I'm privileged to have been able to go and do that and enjoy all those bush tuckers.
Yep.
I always speak Yawara. There's Yawara, Katie, Strawberry.
Language is a barrier too, because you know the language of the local people here is Alyara, so it's very, very important that we have that community involvement to help break those barriers for understanding and education, because it's all right to say the people understand, but it's a better understanding through language that creates that barrier being taken away and hopefully making better choices.
Aboriginal health workers play an important role in their community.
Yeah, very much so. I mean, without the health workers, I mean, because the health worker's role is not just a health worker. They're a family liaison. They're a translator. They're an intricate part of a health service in a community, in an Indigenous community. They're very important people in this community, and they certainly get my respect for it, because without them we would be hitting a wall. We won't get into the intricate understandings of how relationships work, how culture works in regards to, you know, men's business, women's business. Some people can't see other relatives, some can see these relatives. So you try to have a workforce that allows you to try to break down those barriers as well, so that everyone's health is addressed. We really want to take care of our kids. We want to take care of all our people here, you know. And obviously, the best way to do that is having a GP on site who is really the team leader in regards to the medical, as well as having the holistic care coming through your nursing and your Aboriginal health workers. And together, we're all a team. And that's what we're missing. We're missing one of our team players.
Yeah.
That's you, Doctor. And we not only just have Ampilatwatja, we have outstations. We have Nungatapā and we have Arulcha. So those people obviously get service from our clinic once a week at this stage. We want to improve that service and service delivery to 2 days a week. We also have, through having available staff, been able to implement the school checks, which we will also do in Arulcha. We have everything here for a doctor. We just need a doctor that wants to come here and help our people here at Ampilatwatja. We would really, really enjoy a dedicated and team-working doctor, because we have a great team here. We're missing the oversight of a medical officer, and we would really, really enjoy having one here. And the people, I'm sure, would enjoy that as well. I don't know how else to word it.
Yeah.
Pleased with the sign.